Welcome to the presentation on OASIS C1, What Has Changed. This presentation is brought to you by the Clinical Education Department at HCR Home Care. If you have any questions about the content of this presentation, you can contact the Clinical Education Department by emailing ceducation@hcrhealth.com. Effective January 1st, 2015, any new start of care completed will now include the OASIS C1 dataset. The types of changes you can expect to see include the following: deletion of unnecessary items altogether, removal of some items from various time points, splitting of some questions into two questions, revisions to wording to improve understanding and interpretation, and some grammatical corrections. Some of the common clarifications you will find throughout OASIS C1 will include the removal of abbreviations such as EG and IE. These terms will now be spelled out. EG will be spelled out as for example, and IE will be denoted by specifically. Another common clarification you'll find throughout OASIS C1 is specification on the time frame in question, such as with this example of heart failure symptoms. The question asks if the patient is diagnosed with heart failure and has had any symptoms of heart failure at the time of or any time since the previous OASIS assessment. OASIS guidance for this item has always been that the time frame in question includes the time frame of the previous assessment plus any time since the previous assessment. So now we see the language of the question matches the current OASIS guidance. These are the clinical item changes you can expect to see in OASIS C1 that are going to be most significant to your clinical practice. M1033, risk for hospitalization, M1500, symptoms in heart failure patients, M1041, influenza vaccine, M1046, reason influenza vaccine not received, M1051, pneumococcal vaccination, M1056, reason pneumococcal vaccine not received, M2300, emergent care, and M2310, reason for emergent care. The first item we will discuss is M1033, risk for hospitalization. This item currently exists in OASIS C, but has been enhanced to match the current literature regarding hospitalization risk. The M number has changed to 1033 as well. In terms of the item itself, there are a few minor changes. Items 4, multiple emergency department visits, and Item 6, reported or observed history of difficulty complying with any medical instructions, have both been added to the options. Option 2, unintentional weight loss, and 8, currently reports exhaustion, were previously combined into one item but have now been split out. The other changes to this item has been the ordering. These are ordered based on the look back. For example, Item 1, regarding history of falls, looks back into the past 12 months. Items 3 and 4 look back 6 months. Items 5 and 6 look back 3 months, and items 7 and 8 are current. This reordering back on the length of the look back is to aid the clinician in answering this item. The influenza item has had a few changes that are going to enhance the accuracy and understanding of the question. The M number has changed to 1041. The intent of the influenza vaccine question has always been for the clinician to report if the patient received the flu vaccine between the dates of October 1st and March 31st. Now with the revision to this item, the intent is more clear. So this item has been reworded, so the question will now read, does this episode of care, start of care/resumption of care to transfer/discharge, include any dates on or between October 1st and March 31st. If you indicate any part of the episode occurred between those dates, you will respond yes, and will be moved to the next question about if the patient received or did not receive the vaccine. If you indicate any part of the episode did not occur between those dates, you will respond no, and no further questions about the influenza vaccine will be asked. If you indicated any part of the episode has occurred during the specified time frame of October 1st through March 31st, then you will be moved to question 1046, which now asks, did the patient receive the influenza vaccine for this year's flu season? You have 3 options for yes and 5 options for no. Options for yes include 1. Yes, received from your agency during the episode of care. Option 2. Yes, received from your agency during a prior episode of care. This would be a situation where you maybe are seeing the patient in the spring, but they were previously open for another episode, perhaps in the fall, when they did receive the flu vaccine from your agency. Option 3 is yes, received from another healthcare provider, and includes some examples like a physician or a pharmacist, but it's not limited to these types of providers. It could include flu vaccines received at a health fair, hospital, or any of the like. The options for no are basically the same as they have always been and include option 4, patient offered and declined, option 5, patient assessed and determined to have a medical contraindication or contraindications. Contraindications include a severe allergic reaction after previously receiving the flu vaccine, or a severe reaction to a component of the flu vaccine, including egg protein. Option 6 is not indicated. The patient does not meet the age condition guidelines for influenza vaccine. Age guidelines are that all individuals over the age of 6 months who do not have a contraindication receive the influenza vaccine annually. Option 7 is an inability to obtain the vaccine due to a declared shortage. And option 8, the patient did not receive the vaccine due to reasons other than those listed in responses 4 through 7. So let's go through an example. The scenario is Mr. Reed was transferred to a hospital on 9/28/15. You're completing the transfer OASIS on 9/29/15. Record review reveals the patient's start of care was 8/15/15. Documentation states an RN administered the flu vaccine on 8/17/15. How would M1041 be answered? Pause the presentation to think about your response. So M1041 asks, does the episode of care from start of care or resumption of care to transfer or discharge include any dates between October 1st and March 31st? So in this case, the patient's episode started on 8/17/15 and the transfer is being completed on 9/28. So in this case, no part of the episode has occurred between October 1st and March 31st. So the correct response is no. Let's try another question. Mrs. Slade has been discharged on May 1st, 2015. Upon review of the medical record, the assessing clinician determines the start of care was October 15th, 2014, followed by 3 recertifications and no transfers. Clinical documentation states the patient received her influenza vaccine from her neighborhood pharmacist on October 7th, 2014. Think about what would be the correct response for 1041 and 1046. Pause the presentation to think about your response. So in this case, the patient's episode started on October 15th and the discharge is being completed on May 1st. So because the episode includes dates between October 1st and March 31st, then 1041 would be answered yes. For 1046, did the patient receive the influenza vaccine for this year's flu season? The patient did receive the flu vaccine, so we are to choose from options 1, 2, and 3. And of those 3 options, option 3 is the most appropriate response because the patient received the vaccine from their local pharmacist. The next question, which has been modified in C1 for the better, is the pneumococcal vaccine. The intent of this question has always been to document if the patient has ever received the pneumococcal vaccine. The way this item was previously worded made the intent less clear than was ideal. Now, with OASIS C1, the intent is much more clear. Some confusing terms have been removed, such as during the episode of care and the abbreviation PPV. The question has been reworded to ask, has the patient ever received the pneumococcal vaccine, for example, Pneumovox? Remember, we are responding, has the patient ever received this vaccine? In order to know if they received the vaccine in the past, you should either see documentation in the medical record of the patient, documentation in the patient's home, or confirm the information with the physician. Your response options are a simple yes or no. If you indicate yes, you will not need to answer any further questions about the pneumococcal vaccine. If you respond no, you will be forwarded to another question about why the patient did not receive the vaccine. So, if you indicate the patient didn't receive the pneumococcal vaccine, the next question that will come up is if the patient has never received the pneumococcal vaccine, for example, Pneumovox, state reason. Your choices are 1. Offered and declined, 2. Assessed and determined to have a medical contraindication or contraindications. These would include anaphylactic hypersensitivity to any components of the pneumococcal vaccine, if they've had a bone marrow transplant within the past 12 months, or if the patient is undergoing chemo or radiation in the past 2 weeks. Option 3 is not indicated. The patient does not meet the age/condition guidelines for the pneumococcal vaccine. The age guidelines are individuals over the age of 65 and individuals with conditions that would indicate the pneumococcal vaccine is warranted. These conditions include lung, heart, liver, or kidney disease, asthma, diabetes, conditions weakening the immune system, such as HIV, AIDS, or cancer, individuals living in nursing homes or long-term care facilities, or individuals who smoke cigarettes. And option 4 is none of the above. The next item that has had some minor changes is emergent care. This item has clarified the time frame in question and added the term status. So this item inquires if the patient has utilized the hospital emergency department at the time of or any time since the previous OASIS assessment. M1830, the reason for the emergent care, has added some common clarifications. One, in the stem of the question, you'll now see it asks, did the patient seek and or receive emergent care? So that's now being clarified. You'll also see in some of the response options, simple clarifications. The EG abbreviation has been removed, which now it says for example. And in the first item, you can see they added in the clarification of adverse drug reactions as a potential improper med administration or med issue. Okay, moving on to some of the items that have changed in terms of the wound questions. You're now going to be seeing some fairly substantial changes to these items, and probably our biggest OASIS C1 change is going to be one of these. M1307, the oldest stage 2 pressure ulcer present at discharge, has changed. M1308, the current number of unhealed ulcers, as well as M1309, which is a new item that's probably had the most substantial changes in OASIS C1, the worsening of pressure ulcer status since start of care / resumption of care. M1324 has had some changes, that's pressure ulcer stage, as well as 1334, which is stasis ulcer healing status, and 1350, which is skin lesion or open wound. So M1307, oldest stage 2 pressure ulcer present at discharge, has had some clarification to the stem of the question. There used to be the term non-epithelialized used in that stem, which kind of created some confusion. So now the question will read, the oldest stage 2 pressure ulcer that is present at discharge, and to clarify, it says excludes healed stage 2 pressure ulcers, to make it very clear what type of pressure ulcer is excluded from this question. And then again, in the NA option, you can see that no stage 2 pressure ulcer is present at discharge, again removing that non-epithelialized term to make it more clear. The OASIS item that's probably had the biggest change to it in OASIS C1 is M1308. This item has actually been split into two questions. The first question will remain 1308, and we'll be asking about what pressure ulcers are currently present in the individual patient. 1309 will be a new item that will follow 1308, asking about, of those pressure ulcers that the patient has, have any of them worsened since the previous OASIS assessment? So first, looking at 1308, you can see here the question will now read, current number of unhealed pressure ulcers at each stage or unstageable. Enter 0 if none, and this excludes stage 1 pressure ulcers as well as healed stage 2 pressure ulcers. So the item will otherwise be the same. You will be listing the current number of stage 2, stage 3, stage 4 pressure ulcers, as well as unstageables because of a non-removable dressing or device, as well as unstageables because they're covered in slough or eschar, and then finally unstageables because of a suspected deep tissue injury in evolution. So 1309, worsening in pressure ulcer status since start of care or resumption of care, is a brand new item. So this item is intended for you to identify of any of the pressure ulcers that may be present. There are a stage 2, a stage 3, a stage 4, or unstageable because the wound bed is covered in slough or eschar. Have those pressure ulcers worsened since the most recent start of care or resumption of care? So the question will be asking for stage 2, stage 3, stage 4 pressure ulcers, report the number that are new or have increased in numerical stage since the most recent start of care or resumption of care. You will be entering a number, either 0 or any number forward, to indicate if one of those stage 2, stage 3, or stage 4 pressure ulcers has worsened. Now, by OASIS definition, a worsening pressure ulcer is a pressure ulcer that has increased in numerical stage. And that's very important. Remember, we do not reverse stage pressure ulcers. So a pressure ulcer can only advance stage. It can only go from a 2 to a 3 or a 2 to a 4. It can only increase in numerical stage. It cannot be reverse staged. Okay. If your pressure ulcer has, it's a stage 2, it's currently a stage 2, it's always been a stage 2, but now it's infected by OASIS standards, that is not a worsening pressure ulcer. By clinical standards, we would obviously think that that's a worsening pressure ulcer, but by OASIS standards, a worsening pressure ulcer is only a pressure ulcer that has increased in numerical stage. Okay. The second part of the question is going to talk about those unstageables that are covered in slough or eschar. So the question will read, for pressure ulcers that are unstageable due to slough or eschar, report the number that are new or were a stage 1 or stage 2 at the most recent start of care or resumption of care. This question is a little bit more tricky, and we'll talk about it in more detail. But just like the first part of the question, you'll have to enter a number, either a 0 or any number higher. Okay, so looking at the guidance manual for M1309 and just looking at the first part of the question that asks about worsening stage 2, stage 3, or stage 4 pressure ulcers, again, you will be entering a 0 if there are currently no pressure ulcers at any of those stages, or you'll still be entering a 0 if there are pressure ulcers that are a stage 2, a stage 3, or a stage 4, but they have not worsened since the most recent start of care or resumption of care assessment. And remember, when we talk about worsening pressure ulcers, we are talking about a pressure ulcer that has increased in numerical stage. It's gone from a stage 2 to a stage 3, maybe a stage 3 to a stage 4. That is what is considered by OASIS guidance a worsening pressure ulcer. Okay, so let's first look at stage 2 pressure ulcers. On the tablet in the home care home-based system, you'll be asked about each different stage of pressure ulcer. So in looking at stage 2 pressure ulcers, the question will read, for stage 2 pressure ulcers, report the number that are new or have increased in numerical stage since the most recent start of care or resumption of care. It will also go on to tell you can enter a 0 if there are no current stage 2 pressure ulcers, or if all of the current stage 2 pressure ulcers existed at the same numerical stage at the most recent start of care or resumption of care. So again, if you have a stage 2 pressure ulcer that has increased in numerical stage since the most recent start of care or resumption of care, in other words, at the most recent start of care or resumption of care, that pressure ulcer was a stage 1 and now is a stage 2, then yes, that has increased in numerical stage and therefore has worsened since the most recent start of care or resumption of care. If there was no stage 2 pressure ulcer at the most recent start of care or resumption of care, and now there is a stage 2 pressure ulcer, once again, that ulcer has worsened since the most recent start of care or resumption of care, and therefore would be reported here. You can enter a 0 if there are no current stage 2 pressure ulcers or no stage 2 pressure ulcer that has worsened since the most recent start of care or resumption of care. Now let's talk about stage 3 pressure ulcers. So again, you will have an individual question on your tablet for the home care home-based system that will ask you, for stage 3 pressure ulcers, report the number that are new or have increased in numerical stage since the most recent start of care or resumption of care. You can enter a 0 if there are no current stage 3 pressure ulcers, or if all of the current stage 3 pressure ulcers existed at the same numerical stage since the most recent start of care or resumption of care. So remember, you are going to enter the number of current pressure ulcers present at discharge whose deepest anatomical stage is a stage 3 that were not present at the most recent start of care or resumption of care, or were present but present as a stage 1 or a stage 2 at the most recent start of care or resumption of care. Again, either you didn't have a pressure ulcer at the most recent start of care and now you do, or at the most recent start of care, resumption of care, that pressure ulcer was a stage 1 or a stage 2 and now has advanced to a stage 3. Those are the pressure ulcers that must be reported here. You can enter a 0 if there are no current stage 3 pressure ulcers, or there are stage 3 pressure ulcers, but they have not worsened in numerical stage since the most recent start of care or resumption of care. Now let's look at stage 4 pressure ulcers. The question will ask, for stage 4 pressure ulcers, report the number that are new or have increased in numerical stage since the most recent start of care or resumption of care. You will have to enter a number, and you can enter a 0 if there are no current stage 4 pressure ulcers, or if there are stage 4 pressure ulcers, but they have existed at the same numerical stage at the most recent start of care or resumption of care. Okay. Remember, you have to enter the number of current pressure ulcers at discharge whose anatomical stage is a stage 4 that were either not present at the start of care or resumption of care, or were present, but they were present as a stage 1, a stage 2, or a stage 3, and now have advanced to a stage 4 pressure ulcer. You can enter a 0 if there are no stage 4 pressure ulcers, or there are stage 4 pressure ulcers, but they have not worsened, as being evidenced by an increase in numerical stage, since the most recent start of care or resumption of care. Now let's talk about the unstageable ulcers due to being covered in slough or eschar. So this question will read, for pressure ulcers that are unstageable due to slough or eschar, report the number that are new or were a stage 1 or a stage 2 at the most recent start of care. You can enter a 0 if there are no unstageable pressure ulcers at discharge, or if all of the current unstageable pressure ulcers were a stage 3 or a stage 4 at the most recent start of care or resumption of care. So again, we're trying to capture whether that unstageable pressure ulcer that you're assessing that's covered in slough or eschar has worsened since the most recent start of care or resumption of care. If that unstageable pressure ulcer that's covered in slough or eschar was not present at the most recent start of care or resumption of care, it has in fact worsened and you would report it here. If you are looking at an unstageable pressure ulcer because it's covered in slough or eschar, and at the most recent start of care or resumption of care, that pressure ulcer was a stage 1 or a stage 2, inherent in the fact that slough and eschar is present, we know that that pressure ulcer has worsened. We know that because if slough and eschar is present, there has been tissue destruction into the subcutaneous tissue. So if there is a stage 1 or a stage 2 pressure ulcer, slough and eschar cannot be present because those pressure ulcers do not go into that level of tissue destruction. So again, if slough or eschar is present and it was most recently staged as a stage 1 or stage 2, we do know that that pressure ulcer has worsened. Even though we cannot stage it because it's covered in slough or eschar, we know that it is at least a stage 3, if not a stage 4. But it is definitely no longer a stage 1 or a stage 2. If the unstageable pressure ulcer that you're assessing that's covered in slough or eschar at the most recent start of care or resumption of care was a stage 3 or a stage 4, and now you can't stage it because it's covered in slough or eschar, well, we can't really say that that pressure ulcer has worsened. So because of that, we would report a 0 here. So again, if your unstageable pressure ulcer was a stage 3 or a stage 4 at the most recent start of care or resumption of care, and now is unstageable because it's covered in slough or eschar, then we cannot say that it is worsened, and we would report a 0 here. The other instance when we would enter a 0 here is if there just simply are no present unstageable pressure ulcers. Okay. One reminder. Remember, if you are ever assessing a pressure ulcer and it is covered significantly in slough or eschar, but a stage 4 structure is visible, such as bone, muscle, tendon, or joint capsule, then you can automatically stage it as a stage 4, despite how much slough or eschar is present. Again, if you see a stage 4 structure, you will automatically be staging it as a stage 4, despite how much slough or eschar may be present. So remember, with 1309, when we were talking about unstageable pressure ulcers, it will be considered to be worsened if at the most recent start of care or resumption of care it was a stage 1 or a stage 2, because now that it has slough and eschar present, it has worsened because it has moved into some of that deeper tissue. And then remember, if at the most recent start of care or resumption of care, it was staged as a 3 or a 4, and now it's unstageable because it's covered in slough or eschar, we cannot say definitively that it is worsened, so therefore we report a 0 here. One final note about this question with regards to unstageable pressure ulcers is that just make note that we are not reporting any unstageables that are unstageable because of a non-removable dressing or device, or we are not reporting any suspected DTIs. Those items are only going to be captured in the previous question of 1308, which is where we will document what we currently have for pressure ulcers, but we cannot definitively say a pressure ulcer that's covered in a non-removable dressing or device, or a suspected deep tissue injury in evolution. We cannot definitively say that they've worsened, so therefore those ones will not be reported on this item. This is an algorithm for 1309 to help assist you in making a determination of whether your pressure ulcer has worsened or not. And this is information that's going to be included in the OASIS guidance. So just to help you understand how this chart is to make sense, on the left-hand side, you can see the first column is the current stage of the pressure ulcer at discharge. So that is the first column that you're looking at, is where you would be marking or indicating what the stage is at the time of your assessment, which we are inferring is the discharge. The second column is the look back to the most recent start of care or resumption of care. Okay. The third column is the prior stage of that same pressure ulcer at the most recent start of care or resumption of care. And then the final column, all the way over to the right, is whether you would report it as new or worsened. And again, that would indicate that you do need to report that wound, that pressure ulcer, as worsening. So looking at the first row, we'll talk about stage 2 pressure ulcers. So if at discharge you are assessing the pressure ulcer and you stage it as a stage 2, and looking at that third column, if that stage 2 pressure ulcer at the most recent start of care or resumption of care was not present, or was present as a stage 1 and now it's a stage 2, then moving over to the final column on the right-hand side, then yes, we would need to report that pressure ulcer as worsening on M1309. If at the current OASIS assessment that you're completing at discharge, you have a stage 2 pressure ulcer, and now looking at that third column, it is still a stage 2 pressure ulcer, then looking all the way over to the right, then no, it has not worsened, and you would not report it on M1309. You would put in a 0. Okay? Now, looking at that stage 2 pressure ulcer at discharge, if at the most recent start of care or resumption of care it was a stage 3 or a stage 4, well then something's wrong here, because remember, we do not reverse stage. So you can see in that final column, NA, reverse staging is not allowed. So that would indicate that something has gone wrong here. That wound was not staged correctly either at the start of care, or it's not being staged correctly at the discharge. And then the final item, so if you have a stage 2 pressure ulcer at discharge, and then again, looking in that third column, now that pressure ulcer is unstageable, then going over to the final column, no, we cannot say that pressure ulcer has gotten worse because it's unstageable. So if it was a stage 2 if it's a stage 2 presently, and at the most recent start of care or resumption of care it was unstageable, then no, we cannot say it's gotten worse, so we would not report it on this item and we would score it as a 0. Okay, so you can kind of work through this algorithm to help you understand how to score this item correctly. But looking at stage 3s, so you can see if you're currently looking at stage 3 at discharge, and at the most recent start of care or resumption of care, either it wasn't present, or it was present as a stage 1, or it was present as a stage 2, then yes, it has worsened over the course of the episode, and we would report it on M1309 as a number. If it was a stage 3 at the most recent start of care and it's currently still a stage 3, then no, it has not worsened, so we would report a 0. If at the most recent start of care it was a stage 4 and now it's a stage 3, well, there's something wrong there. The wound has not been staged correctly because, again, we do not reverse stage, so that would not be appropriate. And then if at the most recent start of care that pressure ulcer was unstageable for any reason, covered in a non-removable dressing, it was covered in slough or eschar, and now it's a stage 3, well, we can't definitively say that it has gotten worse, so again, we would not report it here. We would put in a 0 for that question. Same thing with a stage 4. If you're looking at that stage 4 at discharge and at the most recent start of care it was either not present or it was present as a stage 1, a stage 2, or a stage 3, and now it's a stage 4, then yes, it has worsened, and you would have to report it with a number, in 1, 2, 3, however many of those worsening pressure ulcers you have, on 1309. If you're looking at that stage 4 at discharge and at the most recent start of care or resumption of care, it was either it was a stage 4 and now it's still stage 4, or at that most recent start of care, it was unstageable because it was covered in slough or eschar or covered in a non-removable dressing, and now it's a stage 4. Well, we cannot say that that has gotten worse, so we would respond no and put in a 0 on 1309. Lastly is the unstageables due to being covered in slough or eschar. This is where it gets a little bit trickier. So if at discharge you're looking at an unstageable pressure ulcer and it's covered in slough or eschar, and at the most recent start of care, it was either not present or it was present as a stage 1 or a stage 2 pressure ulcer, and now it's unstageable because it's covered in slough or eschar, we know that there is substantial tissue destruction to the point that some of that subcutaneous tissue is involved producing the slough or eschar. So we can say that it has definitively gotten worse, and we would report it on 1309. Conversely, if you were looking at an unstageable because it's covered in slough or eschar at discharge, and at the most recent start of care or resumption of care, it was staged as a stage 3, a stage 4, or it was unstageable at that point as well, then we cannot say it's definitively gotten worse, and again, we would not report it as worsening. We put a 0 in for 1309. Okay, so let's work through a couple scenarios to help solidify how 1309 needs to be responded to. So you're completing Mrs. Sanchez's discharge comprehensive assessment. When assessing her skin, you determine there are 2 pressure ulcers, a stage 4 on her left buttock that is 50% covered in slough with observable muscle, and one on her left elbow completely covered in eschar. Chart review reveals at start of care the left elbow was a stage 2 and the buttock ulcer was a stage 3. So how would you report M1309 worsening in pressure ulcer status since the start of care or resumption of care? So let's look at these individually. Take time to respond, pause the presentation before moving on to the correct answers. Okay, so let's look at both of these pressure ulcers individually. So first, at discharge, when we're presently assessing the patient, we identify that there's a stage 4 on her left buttock, and it's covered in 50% slough. Now, even though it's covered in 50% of slough, we do see observable muscle, so therefore we can automatically stage it as a stage 4. Now that buttock ulcer, as we move on here, says that at the most recent start of care, it was a stage 3, and now it's a stage 4. So that ulcer has worsened. So on 1309, we would need to indicate that there is presently a stage 4 pressure ulcer that has worsened. So we would put a 1 in that item. Now looking at the elbow. So her left elbow is completely covered in eschar. So presently at discharge, it is unstageable because it's completely covered in eschar. At the most recent start of care, the left elbow was a stage 2, and now it's completely covered in eschar. Because inherent in the fact that eschar is present, we know that that wound has deteriorated into a deeper tissue level and is now producing eschar. So it is not possible that it's still a stage 2. So if at the most recent start of care it was a stage 2 and now it's unstageable because it's covered in slough or eschar, we can definitively say that it has worsened. We don't know what stage it is. We don't know if it's a stage 3 or a stage 4 because it's covered in eschar. But we know that it cannot be a stage 2 any longer. So therefore it has worsened. So again, we do have an unstageable pressure ulcer present, and it has worsened since the recent start of care, resumption of care, so we would indicate that there is 1 worsened unstageable. Now we don't have any stage 2 pressure ulcers presently, so we would put in a 0 there, and we don't have any stage 3 pressure ulcers presently, so we would put in a 0 there. So let's work through another scenario. You're completing Mr. Stone's discharge comprehensive assessment. When assessing his skin, you discover a stage 2 on his right heel and a suspected DTI on his left heel. Chart review reveals no pressure ulcers were present at start of care. How would 1309 worsening and pressure ulcer status since start of care or resumption of care be completed? So, think about what your response would be. Pause the presentation before moving on. So in this scenario, Mr. Stone is being discharged, and when you assessed his skin, you found a stage 2 on his right heel and a suspected DTI on his left heel. And at the most recent start of care, he had no pressure ulcers. So we definitely have 2 new ulcers. One is a stage 2 and one is a suspected DTI. So for our stage 2 items, we have a worsening stage 2. So for row A, we're going to put in a 1 there. We don't presently have any stage 3 pressure ulcers. We don't presently have any stage 4 pressure ulcers that are worsening. And we don't have any unstageables that are covered in slough or eschar that have worsened. So although we do have a suspected DTI, remember M1309 is asking about any wounds that have worsened as defined by increasing in numerical stage since the most recent start of care or resumption of care. And excluded from this question are any suspected DTIs as well as unstageables that are unstageable due to being covered in a non-removable dressing or device. The next pressure ulcer item that's had some changes is the question asking about the stage of the most problematic unhealed pressure ulcer that is stageable. Now, there's been quite a few wording changes to the stem of this question to make it more clear what this is asking for. So first off, the question is asking for the stage. So we are talking about stage 1, 2, 3, or 4. So the stage of the most problematic, so you need to use some clinical judgment as to what you think is the most problematic pressure ulcer. And then we are looking for the most problematic unhealed pressure ulcer that is stageable. Now in parentheses, it clarifies this excludes pressure ulcers that cannot be staged due to a non-removable dressing or device, being covered by slough or eschar, or a suspected DTI. So all of those types of wounds that cannot be staged are excluded from this question. So you're going to need to use your clinical judgment to identify of the stage 1, stage 2, stage 3, or stage 4 pressure ulcers that are currently present and stageable, which is the most problematic. Now, keep in mind, if your patient, say, has an unstageable pressure ulcer, they have 3 pressure ulcers. They have an unstageable pressure ulcer because it's covered in a non-removable dressing. They have an unstageable pressure ulcer because it's covered in slough or eschar, and they have a suspected deep tissue injury. Then for this item, you would choose NA because the patient has no pressure ulcers that are stageable. Okay? Now, the guidance for this question is recommending you do a couple different things. So 1, the guidance recommends that you first determine which pressure ulcers are stageable. Okay, so of the pressure ulcers that are present, which of them are stageable? Second, determine of those pressure ulcers that are stageable, which of them is the most problematic. And you'll be using your clinical judgment to make the determination of whether which pressure ulcer is most problematic. And it may not be the pressure ulcer with the deepest tissue involvement. So it may not be the stage 4 pressure ulcer. It could be a stage 2 pressure ulcer. Again, you use your clinical judgment to determine which one is most problematic. And then 3, for your 3 steps here, you would then determine and report the stage of the most problematic, observable, stageable pressure ulcer. And once again, just remember, if you're looking at an unstageable pressure ulcer, but you can see one of the stage 4 structures, such as bone, muscle, tendon, or joint capsule, then it is automatically going to be staged as a stage 4, despite how much slough or eschar may be present. The next wound item that we'll talk about is M1334, which is the status of the most problematic stasis ulcer that is observable. Now, this item had always been a little misleading because it used to have a response 0, which was for the status of newly epithelialized. But stasis ulcers heal through granulation, so the only appropriate scores for the status of a stasis ulcer are fully granulating, early partial granulation, or not healing. So in OASIS C1, that 0 option of newly epithelialized has been removed, which is very appropriate because it's not accurate to say that a stasis ulcer is healing through epithelialization. The last wound item we'll look at is M1350, which is skin lesion or open wound. Just some minor changes here to the stem of the question. They added in that this does exclude bowlostomy, and then one little grammatical change with a little comma put in there just to make it more grammatically correct. But what's significant about the skin lesion or open wound question is that it is no longer going to be asked at follow-up and discharge. So it will now only be asked at start of care and resumption of care. Okay, moving on to the process measure items that have had some changes. There have been changes to M2250, which is the plan of care synopsis that comes up at start of care and resumption of care, as well as M2400, intervention synopsis, which comes up at transfer and discharge. So looking at M2250 first, this item has mostly had changes to the NA responses, so a couple minor changes we'll see on the stem of the depression item. But remember, again, 2250 is your plan of care synopsis item. This is where you're going to be indicating if your physician-ordered plan of care includes interventions for some of our best practice items, such as diabetic foot care, falls, depression, pain, etc. The items that have been mostly clarified are the NA options. So now you can see some clarification as well as just improving accuracy to the condition. So for example, with diabetic foot care, you can now see the NA option says the patient is not diabetic or is missing lower legs due to a congenital or acquired condition. For example, a bilateral amputee. Again, adding in the congenital component kind of adds that layer of clarification. The falls prevention NA option has been reworded, so now it says, and you can choose NA if the falls risk assessment indicates the patient has no risk for falls, so that Missouri Alliance or a MAC-10 assessment tool should have indicated no risk for falls. The depression item has had changes to the stem as well, which is fairly significant here. So the question will now read, does the physician-ordered plan of care include the following: depression interventions such as medication referral for other treatment or a monitoring plan for current treatment, and or physician notified patient screened positive for depression. Okay, so now it's added that component of was the physician notified that the patient screened positive for depression. You can respond yes, that your plan of care is addressing depression if you either have interventions about depression medication, you make referral for other treatment, you have a monitoring plan, or the physician was notified of the positive screen. So any one of those situations, you can respond yes. They've also reworded the NA option, so you can indicate NA, your physician-ordered plan of care, does not include or does not need to include interventions for depression because the patient has no diagnosis of depression and the patient's screening indicates the patient either 1, has no symptoms of depression, or 2, has symptoms of depression but does not meet the criteria for further evaluation for depression based on the screening tool. And in our agency, that would be a 3 or higher on the PHQ-2 is that threshold for where we would need further evaluation. Okay, and now looking at the last couple items of plan of care synopsis. So the NA option for the pain item has changed, just the wording. So now you can choose NA if the pain assessment indicates the patient has no pain. So that may have been the 0 to 10 scale. It could have been the pain ad for advanced dementia, the FLACC, or the FACES pain. So if any of those indicated the patient has no pain, you could choose NA. You could choose NA for pressure ulcer prevention if the pressure ulcer risk assessment tool, clinical or formal, indicates the patient is not at risk for developing pressure ulcers. Again, in our agency, we are going to be using the Braden assessment scale on every patient to do a formal risk assessment for pressure ulcers. And if that tool indicates that there is no risk for developing pressure ulcers, here you can choose NA. And then the last item about pressure ulcer treatment based on the principles of moist wound healing, you can choose NA if the patient has no pressure ulcers or has no pressure ulcers for which moist wound healing is indicated. So on those rare occasions where perhaps a wet to dry dressing or a dressing which does not encourage moist wound healing is appropriate, then you could choose the NA option here. So looking at the guidance for 2250, so just to clarify, the guidance now specifies that if more than one assessment, falls risk, depression screening, pain, or pressure ulcer risk is completed, all must be negative in order to choose NA. In other words, you can never choose NA if the patient has any risk for any of those conditions that we screen using an assessment tool, such as the MAC-10, the PHQ-2, the pain ad, or the 0 to 10 scale, or the Braden scale. So if any of those indicate that there is risk, then you cannot choose NA for M2250. And then the biggest change to 2250 is in row D, which is regarding depression screening. So now, if the physician ordered plan of care contains orders for further evaluation or treatment, and or the physician was notified of a positive depression screen, then you can respond yes to that item. Okay, so to solidify that content, let's go through a case scenario. After completing Ms. Burke's Start of Care Comprehensive Assessment, the RN called the physician's office and left a message regarding all her assessment findings, including a positive PHQ-2 score of 4. When the physician's nurse called back the next day, no further instructions or interventions were provided regarding the positive depression screening. How would M2250 row D be completed? So think about your response before moving on to the next slide. So in this case, the patient did screen as having risk for depression on the PHQ-2, but the physician was notified that that patient did have a positive screen and indicated that they did not want further intervention or instruction for the positive depression screen. So now with that new wording on M2250, because the physician was notified that the patient screened positive for depression, we can respond yes to this item. Okay, now looking at M2400, so this is the intervention synopsis item that is answered at transfer and discharge. So this question has had that clarification on the time point, so now it will read, at the time of or any time since the previous OASIS assessment were the following interventions both included in the physician-ordered plan of care and implemented. So again, this question is still looking at the time of or since the previous OASIS assessment for any of those items like diabetic foot care, falls prevention, pressure ulcer interventions. Did we have orders to treat, and was treatment implemented? The biggest change here is all the NA items have had some sort of clarification to them to make it more clear when NA is appropriate to choose. So now looking at diabetic foot care, we can choose NA if the patient is not diabetic or is missing lower legs due to a congenital or acquired condition such as a bilateral amputee. We can choose NA for falls prevention if every standardized, validated, multi-factor falls risk assessment conducted at or since the last OASIS assessment indicated the patient has no risk for falls. And this terminology of standardized, validated is going to be consistent now throughout OASIS C1. So whenever speaking about those tools that we use to assess falls or depression or pain, you'll see that term standardized, validated used consistently. For depression, we can choose NA if the patient has no diagnosis of depression and every standardized, validated depression screening conducted at the time of or since the previous OASIS assessment indicates the patient has 1. No symptoms of depression, or 2. Has symptoms of depression but does not meet the criteria for further evaluation of depression based on the screening tool used. And remember, with the PHQ-2, any score greater than 3 indicates that further evaluation may be necessary. For pain, the NA option now says every standardized, validated pain assessment conducted at or since the last OASIS assessment indicates the patient has no pain. So again, every tool that has been used since the last OASIS assessment must indicate the patient has no pain. For interventions for pressure ulcer prevention, we can choose NA if every standardized, validated pressure ulcer risk assessment conducted at or since the last OASIS assessment indicates the patient is not at risk for developing pressure ulcers. So again, that Braden tool must have been utilized and must indicate that there is no risk. And then lastly, for pressure ulcer treatment based on the principles of moist wound healing, we can choose NA if the patient has no pressure ulcers or has no pressure ulcers for which moist wound healing is indicated. Now lastly, we'll talk about the functional items that have had some changes. So we'll see changes to 1100, patient living situation, 1850 bathing, 1900 prior functioning with ADLs and IDLs, and 2102 the types and sources of assistance. So first looking at 1100, which is the patient's living situation. This item asks first if the patient lives alone, lives with another person in the home, or lives in a congregate setting or situation. And then the second part is it asks for that living situation, how available is the assistance? Is it around the clock? Is it regular daytime, regular nighttime, occasional short-term assistance, or no assistance available? The one clarification that has been added here is that EG term has gone away, so now it says for example on row C. And then you can also see that they added in residential care home as a possible example of a congregate type of situation. One minor change has occurred with the bathing item 1830, and this is actually great because it now clarifies the appropriate response with an area that was kind of confusing prior in OASIS C. So now item number 5, which is that the patient is unable to use the shower or tub, so they are sponge bathing, but is able to participate in bathing self at the bed, at the sink, in a bedside chair, or on a commode with the assistance or supervision of another person. It used to say, with the assistance or supervision of another person at all times, which made it unclear if the patient only needed, say, intermittent assistance, whether option 5 or option 4 would be more appropriate. Now, by removing that last piece that used to say throughout the bath, now if the patient requires any sort of supervision or assistance during their sponge bath, then they will be scored as a 5. In order to be scored as a 4, the patient truly needs to be able to sponge bathe independently with or without any assistance from a human, whether that be human assistance, supervision, cueing, or any other level of assistance. M1900 had a couple changes, so mostly just to clarify. So this is asking about the patient's prior level of functioning with AEDLs and IADLs. So the question will now read, indicate the patient's usual ability with everyday activities prior to his/her most recent illness, exacerbation, or injury. They're adding in that clarification of most recent to make it very clear that we are talking about the patient's most recent condition, illness, exacerbation, injury, to kind of make sure that the response is accurate to the time frame. The other thing that you can see has changed here is that IE abbreviation has been removed, and you can see now it spells out specifically grooming, dressing, bathing, and toileting hygiene. So it has made it very clear that those are the specific items that you need to be considering to answer this question. Again, in household tasks, you can see the same thing. That specifically item was added in. And the last functional M item we'll talk about is M2102, which is the types and sources of assistance. And this has had a pretty significant change. So this item has always been asking for different types of assistance, whether it's ADL assistance, IADL assistance, and there are other ones. For each one of those, we are indicating whether the patient needs assistance with the activity, and if their caregivers need any are able to provide assistance, if they need training providing that assistance, if it's unclear if they're going to provide the assistance, or if the assistance is needed and there's no caregiver available. So a couple things that have changed here. The stem of the question has changed with minorly. So now it's going to specify what type of caregivers the responses are referencing. So it used to previously say just caregivers generally. Now they've added in wording to clarify that they're talking about non-agency caregivers. So the question will read, determine the ability and willingness of non-agency caregivers, such as family members, friends, or privately paid caregivers, to provide assistance for the following activities if assistance is needed. And just to make this even more clear, they commented that this excludes all care by your agency staff. And you can only choose one box for each row. So looking at ADL assistance, you can see that EG term was removed and now it says, for example, transfer, ambulation, bathing, dressing, toileting, eating, and feeding. So let's look at ADLs. So for ADLs, your options are going to be either no assistance needed, patient is independent or does not have a need in this area, so your patient does not have any need for ADL assistance, or non-agency caregivers, and again, this item now specifies that we are talking about non-agency caregivers. So those non-agency caregivers currently provide assistance. Or in column 3, you can see non-agency caregivers need training or supportive services to provide assistance. Now in that fourth column, you can see there's been a couple changes here. So there used to be two separate items. One was that the caregivers were not likely to provide assistance, and another column was that the caregivers it was unclear if they would provide assistance. OASIS has now merged those together, so there's only one item, and it says non-agency caregivers are not likely to provide assistance, or it is unclear if they will provide assistance. And then the last column, you can see assistance is needed, but no non-agency caregivers are available. Okay, so let's work through a case example. So after interviewing Mrs. McNichols and her son at Start of Care, you discover she needs help with most ADLs and IADLs. Her son is her only caregiver, and he willingly helps with everything except bathing and dressing. He states he's just not comfortable providing that needed care for his mother. The patient uses the phone independently, and the son assists her with all other IADL tasks. What is the appropriate response for M2102, types and sources of assistance, rows A and B? So the question will read, determine the ability and willingness of non-agency caregivers, such as family members, friends, or privately paid caregivers, to provide assistance for the following activities, if assistance is needed. This excludes all care by your agency staff. Think about your response before we're moving on to. So in this item, you can see that our patient, Mrs. McNichols, does need assistance with ADLs and IADLs. She currently has a son who is her active caregiver. He's assisting with everything except for bathing and dressing. So in this case, with the examples of ADLs, such as ambulation, transfers, bathing, toileting, dressing, eating and feeding, she does need assist, but it is unclear if the son will be capable or willing to participate in that. So we would choose option box number 3 for row A. The non-agency caregiver, i.e. the son, is not likely to provide assistance because he's not comfortable with it, or it's unclear if he will provide assistance. So that would be the appropriate response. And then for IADL assistance, the son is currently assisting with all IADLs except the phone, which the patient can use independently. But again, we score based on the area that the patient has the most difficulty with. So he is assisting with all IADLs. So therefore, we would choose option number 1, that non-agency caregivers, i.e. the son, currently provide the assistance with IADLs. Lastly, I'm just going to mention there are a couple items that have been deleted from the OASIS C1, so we will no longer be answering M1012, which is inpatient procedures, where we were previously had the ability to put in a diagnosis code, although that information has not really been collected or utilized by OASIS in a while now. M1310, 1312 and 1314, the pressure ulcer length, width, and depth have all been removed. And M2440, the nursing home admission reason, has also been removed. So if you have any questions or you want more information about OASIS C1, you can go to any of the references on the screen here. The OASIS C1 ICD-9 changed items and data collection resources has been a primary source for this presentation. If you'd like to see a detailed webinar on the information from that, you can follow the link through OASIS Answers. The Centers for Medicare and Medicaid have also posted much information about OASIS C1 and the OASIS C to OASIS C1 crosswalk that can be found on the link of the third item on there will directly show you what OASIS C was or what the questions used to be and how that compares to OASIS C1. So also a great reference if you're interested. Again, if you have any other questions, though, you can always email our education department at HCR by searching in your contacts on your tablet, C Education, or by emailing ceducation@hcrhealth.com.